Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the FIA Group.
Welcome to another episode of our Empowering Plans Podcast. I am Jen McCormick, and today I am joined with Kelly Dempsey. Hi, Kelly. How are you?
I'm good.
And I know that we are excited to talk about a topic that is close to both of us and is very important, not only generally outside the landscape of how self-funded plans and employers are addressing it, but generally outside in the world and our day-to-day lives. We're talking about mental health, and in particular, mental health parity and the Addiction Equity Act. So in talking about this topic, we thought it was important as we're getting close to 2024, we're here, it's arrived, and we have to figure out as we're talking through renewals and making sure that we're thoroughly reviewing our plan designs, how our benefits are being administered, that we're making choices that not only align with what our current employee population's needs are, but also are being compliantly administered. So this is certainly a topic that has gotten a ton of interest. It has become a priority for a lot of different states and federal agencies, and we're starting to see mental health related issues pop up in litigation around the country. So this is becoming a very important issue to make sure that we are aware of the why, the background, to understand really what it is that we're trying to help people with when it comes to their plan designs and why this is just such an important piece. So as a quick refresher about mental health parity, while there has been a history and the evolution of how the regulation has come to be, as it stands currently, there is a requirement under the mental health parity laws that any sort of mental health or substance use disorder benefits are being offered in parity with medical and surgical benefits. And we're starting to learn that this can come in the form of qualitative treatment limitations, which could be dollar limitations, financial limitations, or non-qualitative treatment limitations, which are things that are maybe a little bit trickier to understand, but how medical necessity is being determined, or how prior authorization protocols are being handled. And keeping in mind both those things, whether it's both financial or non-financial limitations, we need to keep up with the way that the world is evolving, the regulations and healthcare regulatory landscape is evolving as well. Things are changing in how people are requesting and receiving services, and it's going to be important for us to keep up with those changes by reviewing the health plan documents and provisions themselves to ensure that we're up to date with how those provisions are being outlined. Another consideration here that we're finding that this is such an important topic to talk about now is that we are seeing more now than ever advances with technology and how certain things are being handled with AI and how different systems are being customized and changes to make sure that as we can receive healthcare, the technology that's behind that, whether it's how a method for treatment may be received, we need to make sure that from the mental health parity space, that those technological advancements are not only a part of how the medical and the surgical benefits are being administered, but also on the mental health side as well. Another big issue why we thought was important to talk about this too is that we are seeing this as an issue. We want to bring some awareness. It is important to have engagement with our employees. We want to make sure that when it comes time to understanding their benefits, that this is something that is a benefit in our plan and not something that we're seeing as a mental health benefit, but a benefit for mental health or benefit for medical services that is available, that people don't see this as a obstacle to receiving care, that there's no stigma that's being attached to receiving these types of benefits, that they're readily available, that there's awareness about the benefits that are available under the plan. Also, we want to make sure in talking about this today that we can go out of our way to ensure that there are no particular barriers when it comes to how you can get that coverage. We want to make sure that there is coverage for mental health or substance use disorder benefits that is exactly on par or in parity with medical and surgical treatment limitations and benefits, that there's no financial protocols or obstacles that would prohibit somebody from otherwise receiving the care. We want to make sure that it is generally accessible. So in keeping those background issues in mind, that's why it's important today. And our objective for our discussion today is to really highlight for you some of the major issues that employers should be looking at, revising, addressing, and reviewing, and coming up with best practices within their plan documents to make sure that they are on top of these changes. They know exactly what they should do and how they should change those, because we know that the DOL and the EDSA are prioritizing this. They have staff for it, they have funded for it. This is a priority. We expect more audits, more litigation, more questions, more appeals related to mental health services. So we wanted to share with you some of the issues that we have seen over the past year coming up with plan provisions that we hope we can share with you as an opportunity for you to review your plans for 2024 and capture some of those changes. So with that, Kelly, how about I turn it over to you to walk us through some of these high-level changes that we're recommending plans take a peek at and make sure they're up to date with the mental health parity rules.
Absolutely. I think a couple of the updates that we are making, part of it is reframing our mindset. And it's, it goes to what you've talked about when it comes to societal changes and our response to the COVID pandemic and mental health impact, but just how we're looking at certain diagnosis and other items and issues that impact individuals on more of a human level, is that sometimes we've been siloed and we try to silo a benefit or an exclusion into one regulation, and we're a little short-sighted, not realizing that it might impact multiple areas of compliance for the plan documents and the employers and all those things. So I think that's kind of a broad stroke of why we're reframing things. It really goes to that whole concept of the non-quantitative treatment limitation and all these insights that we are receiving from these regulatory bodies. Because if you're not aware, one of the services that we have started providing is that we are drafting those comparative analyses. We're drafting those as a service to some of our clients. So that's an option that we are working on. And as we're going through these and doing these over and over again, I mean, we started, was it 2021? Was it really that long ago? I can't think of from a timeline perspective, but it's been a couple of years now that we started these requirements and we started working through these. So we've been working with a lot of employers really closely, and we've gotten a lot of feedback from different regulatory bodies because we have worked with several groups and clients through actual DOL audits on these. And that's why we realized that it's time for a change. And that's usually, one of the big reasons why we do change our own template materials is related to what we learn from the industry and through real life situations. So there's three main areas of our template that we have decided to change. And when I refer to our template, I generally mean our major medical materials. Some of these benefits pop up in a couple of other versions of our template. You may have heard us talk about our flagship template, which is our best practices template, but is also a major medical template. So when I refer to that, I refer to kind of a broad scale medical plan that may or may not have these benefits and exclusions. If a plan is just not covering mental health parity or mental health parity services, mental health substance use disorder, that is an option. When it comes to mental health parity, you don't actually have to cover these services. That's the first threshold. The first threshold is if you offer these services, then you have to do it in accordance with your medical surgical benefits. So the first step, we've talked about detoxification as an exclusion, and it kind of goes hand in hand with one of the other ones. But when we talk about detoxification, I think, again, there's always been a mental health stigma with detoxification, but it's become, more important. And as we look through these things, we start realizing that it's tied very closely to mental health parity, and it's become a problematic exclusion. So detoxification is the first exclusion that we are removing. And I'm going to go to the other substance use disorder one because I feel like they're easier to kind of talk about together. So the other one is related to tobacco smoking cessation. So this was another exclusion that previously existed that we are generally not recommending anymore. For non-grandfathered plans that have to follow preventive care ACA benefits, there is a component under the ACA preventive care about that tobacco smoking cessation that has to be covered. So there is a component of preventive care services as well as mental health parity with this, as you see the overlap between multiple requirements. So again, there might be a little bit more wiggle room for grandfather plans, but grandfather plans still potentially have to comply with mental health parity if they're covering those services. So they have to do so in parity with their medical surgical benefits. So tobacco smoking cessation has also become problematic for grandfather plans if it is an exclusion. So we're recommending that exclusion also be removed and not exist anymore. The third one is the gender affirming care, and related to excluding that. It's always kind of been our position when we look at the requirements under Section 1557 and now mental health parity, the conservative approach has been cover it all. If you are a covered entity under 1557, that is what a lot of the big carriers have done, is that they went to that broad. We're covering everything from surgery to therapies, as well as prescription drugs, because they had to, because they were covered entities. There's always been a little bit more of a gray area for those that are not directly subject to 1557, but still are potentially have oversight from the EEOC and may still, want to include that exclusion. We also understand that this is a sensitive subject for many, many reasons. It becomes potentially a religious issue, as well as a social issue and a mental health issue. So we know it's a sensitive topic, and we realize it's important, and that's one of the reasons why we're talking about it. But compliance is also important to us, and that's what we're advocating for here, is the compliance aspect. It's being able to comply with 1557, as well as mental health parity, and avoid a audit or a deep dive and finding that the plan wasn't processing claims compliantly. So those are the three items. And again, it's detoxification as an exclusion, tobacco smoking cessation as an exclusion, as well as gender affirming care as an exclusion. So those are the three exclusions that we are focused on when it comes to this round of updates that we are looking at in light of all that information that we've been gathering over time as we work on these comparative analysis. So Jen, you want to start diving a little bit more into the details, kind of the nitty-gritty background of why we made these and the specific recommendation?
Yeah, so I think that it's important. Thank you for highlighting some of those, is that those are not the only changes that should be made for a plan to ensure that they are compliant or in line with the evolving rules and regulations when it comes to mental health parity. But those are a couple of examples of the things that we're continuing to see that are brought up as a potential red flag that should be reviewed. Because when we're looking at provisions and we're looking at plans, the compliance piece, particularly when it comes to the NQTL, is based not only on the language, but ensuring that the language matches the protocols and the procedures that are in place. So as we're having discussions here, we're only helping with half of the problem. So if there is a behind the scenes protocol or a behind the scenes process, even if you're matching the language and the language in and of itself is 100% correct, there's no funky exclusions or issues with how things look on paper or in the schedule of benefits, that doesn't mean that you can ignore or avoid potential protocols, procedures, or policies, or any other manuals that may have separate rules or provisions or restrictions that may not necessarily be something you would automatically see if you're a plan participant. So we're highlighting these as a way to start the conversation, just to put everyone on alert that there are ongoing changes. And this is not something that we expect that we're going to be able to review or to outline all of the changes or all of the rules for what needs to be done today and expect that there'll be no changes tomorrow. I think that's one of the things that we're anxiously, eagerly awaiting, is that there are those proposed changes to the mental health rules out there. And they were issued in August, and we're waiting for those rules to be finalized. And should those rules be finalized, maybe in the current form or in a different form, there will be changes that plans will need to make, and not only their plan language, but also in the way that they are processing or administering their benefits. So this is the start of this conversation to highlight some of those things so we can be aware of the opportunities that we have to really dig in and make sure that we understand what our language says, why our language says this, and the implications of doing this, because we want to make sure that when we're offering the benefits in our employer benefit plan, that we're staying true to what this is. It's an employee benefit. We want to make sure that we're truly offering benefits that are not only compliant, but they align with the strategic and the regulatory goals that have been outlined and as we understand them today, with a caveat that they may change tomorrow. So with that, we appreciate you dialing in, and if there are further questions, we're always here to dig into this, as this is an important ongoing topic and something that should be addressed and not ignored, because there are some consequences and implications for failing to address these issues when it comes to compliance or mental health parity. Before I wrap it, are there any final words of advice or recommendations that you would leave people with here, Kelly?
Yeah, I think the moral of the story is to make sure you're doing your comparative analysis. Know that the requirement is kind of similar to your SPD reviews, is that you're supposed to be updating and reviewing these on an annual and regular basis, because you're supposed to be having them based on your most current and frequent data. So I think that that's kind of the moral of the story, is try to shift the mindset, think about comparative analysis the same way we think about our plan documents and keeping those up to date. And I think you really just, hit the nail on the head when it comes to this isn't the end of the changes. I feel like that's been the moral of the story for a really long time. And, unfortunately, we can't keep the regulators from continuing to change things, but it's always out there that there are more changes and more changes to come. And these documents are considered living, breathing, fluid documents. And we just got to, make sure to give them CPR from time to time.
Awesome. So thank you so much, Kelly. On behalf of myself and Kelly, thank you so much for tuning in for another episode of our Empowering Plans podcast.